Welcome back to Why We Nurse. I'm your host, Serena Tobar, and today we're exploring a unique and powerful path in nursing, legal nurse consulting. I'm joined by Khaleela Uhmeni, a legal nurse consultant who uses their clinical expertise to support legal teams, review medical records, and advocate for justice in healthcare. In this episode, we will dive into what LNCs do, how they bridge the gap between medicine and law, and what it takes to step into this specialized role. Welcome, Khaleela.
Thank you.
Let's start with your journey. What led you to nursing?
So, what led me to nursing? Well, when I was younger, probably like 14, 15, my aunt was a LVN and she worked in a nursing home. So, as she worked in the nursing home, I was allowed to come and volunteer. So, I basically came and read to some of the residents, also just sitting down and talking with them. If they were okay with somebody feeding them, if they didn't have any precautions or anything like that, I was able to feed them. And so that's when like it kind of sparked my interest. Then my family has basically we have breast cancer that runs very rapidly in our family. So also seeing how the nurses that came to the house cared for them also led me to want to become a nurse. At first I didn't know that I wanted to be a nurse. I thought I wanted to be a doctor. But then as I started seeing some of the differences between being a doctor and being a nurse, I knew that I wanted to be a nurse.
So, how did you discover legal nurse consulting?
So I actually did not know about legal nurse consulting before I started legal nurse consulting. My background in the hospital setting is surgical services, so like operating room, interventional radiology, GI, pre-op, PACU, and some cardiology, and doing patient safety. So I was used to looking at safety events or looking at timelines and looking at deviations in care and helping develop strategies. So I did have a major operation like about a year ago. And so of course, when you're have more time, I started looking at like what am I good at? Like, I've had a business in the past. And I even did like personality test. And basically it kept coming up like research, analytical type work, and then it even came up legal. And I'm a person that like I love to research everything. And so then that's how I found out about it. And of course, I spent hours upon hours and weeks looking at what it takes to become a legal nurse consultant. And then, making sure that my skills matched that kind of profession.
That's a really interesting kind of way to fall into something. Well, you had a major operation and it kind of changed your life in more ways than one.
Yes, it did. It definitely did. I feel like maybe after having my operation that I was like, okay, I'm finally ready for that next phase in my life. Um, yeah, so I started, and I always knew I wanted to have my own business. So that was also one thing is like, because when you have your own business, it's like people can go do anything, but why not do something that you're good at and then still helps you live your mission? Because like one of my personal things is like, improving patient safety and not just improving patient safety, but also helping healthcare providers, um, navigate difficult situations if needed.
So, was there a moment or a case that made you realize this is the path I'm supposed to be on?
Well, I first started off doing like mass tort cases, and that was definitely a good opportunity. I started off subcontracting, basically working under another legal nurse. And I just really, truly liked going through the medical records from the beginning to the end. And sometimes it could be like thousands of pages, but I was like, this is where I want to be. So that really helped me decide that this is something I really want to do. And then you get to use that analytical mind of bringing in your nursing experience of like, okay, this is usually what happens with this condition. This is how the team will work with this patient, or this is how the communication that looks behind the scenes.
Okay. So, how did you transition from clinical nursing to legal nursing?
So, clinical nursing, so just a little bit about my background. So, I started off as a med surg nurse. I've been a nurse almost 20 years now, taking care of surgical patients, all kind of patients. Then I transitioned back to Houston. And once again, I was on a med surg unit there. And then I started an OR fellowship. In that OR fellowship, I loved it. So I became an educator and then kind of went into patient safety. So as of now, I actually still work clinically, not necessarily at the bedside, but more in the patient safety education environment. So the transition is I actually do both. I do legal nurse consulting and in clinical work, and I the nice thing about doing both is we want to stay up to date with what's happening in in healthcare, and I believe staying at the bedside or even being in the hospital setting or an approximate to it is helps you stay up to standards and what's going on and the real challenges that we may face in healthcare.
So, was there any kind of training or certification involved?
So some will say that really and truly your nursing knowledge itself is what attorneys need, kind of bridging that information so that way a layperson can understand what's happening in healthcare. However, I do recommend that you do some type of training. It could either be reading a book, it can be taking a course to get abreast to basically the four things that you have to have, like the duty, the breach, the causation, the damage, is understanding what that means and what the standard of care means because best practice may not always be the standard of care. It's pretty much what most nurses or most healthcare providers would do in the same similar situation.
So, I know that we've worked together for the Texas Nurses Association. We did a mock trial, and
Mhm.
would you say that having something like that is important for nurses to see how what they do at the bedside could play out in a courtroom setting?
Yes, I think it's probably one of the most eye-opening experiences that a nurse can have because most of our focus is taking care of our patient. you know, we're not always thinking about the legal aspect of it or what this can mean for my license, per se. So I think having that experience, understanding, what needs to be present for there to be a lawsuit, understanding how our documentation may play a part in a case, because I tell people some of these cases don't come across for a couple years. And one question that I like to ask people when I
Mhm.
do education was like, what did you eat for breakfast like 2 weeks ago? Who can remember? Nobody remembers what they did 2 weeks ago or what
Right.
they ate for lunch 2 weeks ago, unless they eat the same thing over and over again. So I tell them that your documentation is what's going to help you in a situation like that. Then not only understand like if there's a suit that's brought forth, sometimes it's not even your practice that's called into question. It may be something that occurred in a different part of the hospital or with another provider, but you're going to have to possibly answer some questions related to the care that patient was provided. And as I said, the best way for you to remember is referring back to your documentation.
So, can you walk us through a little bit about what does a legal nurse consultant actually do on a day-to-day basis?
So on a day-to-day, so the good thing about legal nurse consulting, like nursing, there's several things that you can do. You can either go in to be an expert witness. What I do on a day-to-day, as I said, I still work clinical, so I don't always work on cases every day. But in the legal nurse consulting world, you can either do what we call expert work, which is highly recommended that you're at the bedside to do the expert work. And then we have behind the scenes. I primarily do behind the scenes work. That's the beautiful thing about nursing and legal nurse consulting. You don't have to do everything. You can do things from medical malpractice to personal injury to even criminal defense cases if needed, or anything that has healthcare tied to it or medical records tied to it. So for me, I primarily behind the scenes where I review hospital and nursing home cases. So I help from intake. So basically, from the time that my attorney or one of my clients receives a potential case to review it to see if there's a potential case there, I will say that 90% of the time or more that it's not a potential case. So help from that part all the way up into trial or depositions. So it can be pretty wide variety of things that you can do within the legal nurse consulting world. But I do from intake all the way to trial or deposition. So then to add, so what it looks like is I'll receive the records. It's electronic. Depending on what the client needs, if I'm screening the case, I'm going to screen it looking for first of all if there's any damages, because if there's no damages, there's no case. You can have a situation where there was deviations in the standard of care, but there was no bad outcome to the patient. So therefore, there would be a case that I would let them know that there's likely no merit. Of course, all these cases would have to go to an expert if they thought there was merit, because as behind the scenes, I am basically doing a preliminary review of the records to help advise my client, on whether or not this is a potential case or not. When it comes to, let's say they decide to move forward with a case, I can assist with a chronology, either or a fact summary, or even helping locate experts they may need.
So I heard you talk a little bit about personal injury, and you said some torts, but what cases are your typical cases?
So for me, my typical cases are nursing home cases. So those are going to be falls, pressure injuries, some choking cases. Those are primarily the ones that I get from nursing home. From hospital cases, it can be a very large range. It can be from surgical. A lot of people come to me for surgical because that's my background. Surgical, if there was like a complications and they're alleging that there was delay in care or a misdiagnosis, I would review those. Surgical, sometimes it is they came in through the emergency room and they were seen and then they left and they had an outcome, a bad outcome after leaving there. Some fall cases, occasionally some medication errors. But as I said, most of the time, as I said, 90% of the time, there's no claim.
So how do you use your nursing knowledge to support these legal teams?
Well, using my nursing knowledge as a nurse and working in the hospital, we do learn about different medical conditions, what to anticipate, the labs, the orderings, and those sorts. Then also, as legal nurse consultant, not just relying on that, but also going back and doing research for your client on whatever condition the patient was having at the time. And then the difference between having a nurse is I usually say like we're like the middleman in the hospital. Like we're the ones that kind of like coordinate the care. So we know how things interact with pharmacy. We know how things interact with physical therapy. We know how to, how consultations work between physicians and how how what it really looks like when a patient goes to a procedural area and comes back. So I think that's the unique value that a nurse brings, is that we really understand that global aspect of what really happens with a patient, or the things that happen behind the scenes to help our patients. Because as I said, we're usually the ones ensuring that all those pieces come together.
That's very, very true. Very, very true. We are like kind of have to know a little bit about everything and be almost an expert on everything, which is, you know, usually people are expert in one thing, but we kind of have to know everything because we have to know medication dosages and we have to know,
Mhm.
how to give the medication and we have to be able to anticipate what a doctor might order. And we have to be able to know the signs and symptoms. And then we have to be able to know, is a patient truly ready for surgery or if they're not ready for surgery, and how to take care of them when they come back from surgery and how to get them ready for surgery.
Exactly. And as nurses, we we follow orders, but also we have to advocate for our patients. So if we see something that doesn't seem right, as a nurse, we are responsible for speaking up. We just don't follow orders blindly. I think understanding that's how nurses function in the hospital, nursing homes, and a lot of different places. That's the value that we bring to when we review these records. But of course, if there's a medical situation, that a physician's still going to be the one that, if it's in their specialty area, to review it if there's actually truly merit. So we're just screening as behind the scenes. And with that screening, the attorney client will just make a decision on whether or not to pursue the case and send it to an expert to do a further review.
What would you say is the most challenging part of being a legal nurse consultant?
For me, I would say just because I'm a compassionate person, is seeing some of the devastating things that happen to people. Really, I would say that probably is the most challenging part, and then also seeing that sometimes it's really just truly a bad outcome. It's not that anybody did anything wrong in those situations, and then also seeing sometimes where healthcare did fail a patient. That can be challenging to see that happen. But that's why I do this work, is, you know, to help my clients be informed on how to move forward with their cases, how they see fit.
So, how do you stay current with legal and nursing standards?
So, depending on the kind of case, I'll go to whatever that association is. There's different databases that you can go look for authoritative literature as far as nursing, continue education. Um, is pretty much how I stay up to date. I do participate in some local bar associations, and when possible, I will attend their continue education also to stay abreast of what's going on in their world too.
What advice would you give a nurse that might be interested or curious about legal nurse consulting?
First, do your research. I say that because in legal nurse consulting, it is very detailed oriented. Having good writing skills, good communication skills. One big difference between this kind of nursing and the bedside nursing is in medical records, we chart healthcare, but when you're communicating to clients, you have to be able to write in a fashion that is clear for them to understand what actually occurred in the medical records. I think that's a challenge that a lot of nurses may have when they transition over. And so, as I say, good communication skills, good writing skills, and very detailed oriented because whenever you look at records, on first glance, things may look fine. But when you start putting together a timeline and um, adding in consults, H&Ps, medication administration, and working through that, that's kind of when you start seeing, well, maybe in this situation, it might have been related to this medication. But looking at medical records electronically and looking at medical records on a PDF is different. In the medical record, you just go click under medications. In the PDF, you have to go search for those
Hmm.
medications and and you have to line up the timing with the alleged event to see if something occurred.
Yeah.
So I definitely say you have an eye for detail, you have good communication skills, written and oral skills, that this could be something for you. And you have to like to read and research.
Yeah, and I think it's important also to remember attorneys are experts in attorney language, right?
Mhm.
And as nurses, we love to talk in our jargon and we love to talk in our abbreviations and our acronyms. And so, we can't just tell an attorney an EGD. He might not know what an EGD is. We can't say the
Exactly.
big giant word gastroesophageal duodenoscopy. We have to break that down. Okay, this is what this means. This is what happened. This is where the procedure the patient went to. So that goes back to that good communication and good writing. And can you break it down for somebody? So I tell people all the time when I'm talking to, like, say, um, the AC guy, right? I'm having my AC replaced, and so I'm like, break it down to me like I'm 5 years old because I don't know that language. So even
Mhm.
though I'm a very intelligent person, I am all but dissertation on my PhD. I need that broken down to me like I'm 5 years old because I don't know that language. So it's like another language that I'm being taught. And we have to remember that that's kind of the same. Like they may know a little bit of medical language because they're medical attorneys, but we still got to kind of break it down to them.
Exactly. And even sometimes, if I'm reviewing a case and it's completely out my I'll let my client know, like, that's completely outside of my scope. I can find you somebody else that can help with this case, particularly because occasionally I make it something that I'm like, yeah, this is very specialty focused, where somebody that has the expertise would most likely benefit from reviewing that. For example, like birth injuries or things like that, I would probably highly recommend that somebody that's very specialized in that. I could maybe do a preliminary review because based on my nursing knowledge, but to really get into the details of like fetal heart tone monitoring and things like that, I definitely think, bringing in somebody that has that specialty to understand those readings.
So how do you find the people that you bring in? If you had a birth injury case, how would you find somebody to help with that case?
Well, networking is one way. We're nurses, so we know nurses. So that's a good way of knowing. And then there's a lot of nurses in the legal nurse consulting world. Somebody that you know that's credible, that does good work, you can reach out to them or refer the case to them.
So I know you talked a little bit about being detail oriented, a good communicator. Are there any other skills or qualities that would make someone a good fit for this role?
I think if you definitely are interested in another form of nursing, this is definitely an opportunity in this lane to be able to do this kind of nursing. I will say if you have the clinical knowledge, of course, you're going to need to have some years of experience and you're eager to make yourself a little bit uncomfortable, to learn something new. This is definitely a great space to be in.
How has this work changed your view of nursing and its reach beyond the bedside?
It has definitely opened my eyes a lot more to how we document, how we document our care. Really has really opened my eyes. In nursing, we use a lot of templates, which is fine. It helps save time, but just making sure that when we use our templates, that we're actually changing the information within our templates to match our assessments or match the care that we're providing for those patients.
And I would definitely agree with that. I've myself been someone that's used templates, and you do have to be very, very careful because it's easy to miss something and not document correctly. Like, for example, say you're using a template and the template defaults to a left arm blood pressure, but your patient has a AV fistula in that left arm, and you know you're not supposed to be taking
Yes.
a blood pressure over the top of an AV fistula. And so if something were to happen and that record gets reviewed, then it's going to look like you did the wrong thing and you maybe caused an issue with this AV fistula. And so we do have to take that second to pause and say, okay, wait, let me make sure that what I am fixing to submit right here as documentation matches what I actually did.
Exactly. And then also I would just the patient safety side of me is like advocate for your patients, advocate for yourselves. Sometimes in healthcare, I call it normalized deviation, where we're used to a situation being like this all the time. So we just get used to practicing that kind of way. So I would say definitely always speak up. If you within your unit can make a change, try to make those changes. If you need assistance, escalate, escalate, escalate. So that way, not only are you protecting your patients, but you're also protecting yourself.
Right, right. Nurses tend to be the kings and queens of workarounds. And so we really have to, we're so busy. We have so much on our plates, and we really just were like, we need to get this thing done so we can move on to the next thing. This call light's going off. I need to finish this so I can go to see what, I don't want my patient to fall or whatever. And so not trying to say that anybody is malicious in any ways, but we do tend to do a lot of workarounds. And sometimes we just have to reach out and say, hey, this equipment is not working the way it's supposed to. This machine is not working the way it's supposed to. And I've had to, piecemeal something together so that I can get done what I need to get done. But we really need to make sure that it gets tagged, it gets noted, and we're escalating that so that somebody can come fix it. We don't have to be the ones to fix it. We're not going to be the ones to fix it, but we want to make sure that we're saying, hey, this is broken, point the fingers, shine the lights on it, and let the organization know, hey, I need this fixed so that I can provide this proper patient care so that we don't end up in a lawsuit situation and having to settle for thousands and thousands of dollars.
And then also, it's like, your goal is to take the best care of your patient as possible.
Exactly.
So, yes, lawsuits are a thing, but we all want improved patient outcomes or getting a patient back to whatever their baseline is going to be. So, just want to make sure that we don't do shortcuts in making sure that we don't get used to things being broken and that we speak up when we see a broken process. But not just only speaking up, but if you also have a solution, bringing forth a solution,
Mhm.
because who best to know about the solution than the people that are most likely doing it every day.
Yes. And I say that all the time. I do new employee orientation at my organization. And so I'm always telling the new people, like, hey, because our organization is so open to like new ideas. And we're like, hey, you guys are the ones who work this process day in and day out. And they recognize that, yes, our executives have a place and our leadership has a place and everybody has their place. But they also recognize that having somebody that is 10 steps away from the process being the sole dictator of the process is not a good idea, and that we really need the input from the person who's doing it day in and day out. And that's important for nurses to be on those committees, to be on those project teams so that those processes can be put in place the right way so that nurses can work through those processes and not make shortcuts.
Exactly.
So, Khaleela, how do you get your attorney clients, or where does your work come from? Do you report to somebody every day? How do you get your work?
So, for me personally, most of my clients find me on LinkedIn. So they will reach out to me on LinkedIn saying that they potentially have a case for me. Uh, but that's because I'm present on LinkedIn. Or if I have current clients, they may refer somebody else to me. But as a legal nurse consultant, you don't have to have your own business. You can decide to go work for a law firm. You can decide to go work for an insurance company. So it doesn't have to be one way on getting clients. I just personally like running a business and and doing that part. So I don't report to anybody. I report to all my clients. I guess you could say to meet their needs. But I will definitely say is it takes a while. If you're doing about it with your own business, I believe some people say that it can take anywhere from 6 to 9 months, some people even over a year to get their first case. So I like to give that transparency to people that decide they want to, because they may see ads or they may see some shiny on social media about, "Oh, we can go into this and make this kind of money." For me, of course, we all want to find something that we can make money for. But for me, this is really truly about my personal mission. One of my personal things is patient safety. And so for me, this is also a way to globally impact patient safety.
Thank you so much, Khaleela, and thank you for being our guest today. Legal nurse consultants remind us that nursing isn't just confined to the bedside, it's a voice, a lens, and a force for accountability. Khaleela's story shows us how clinical expertise can protect patients, support justice, and elevate the profession in powerful ways. And that's why we nurse. Thanks for joining me for this episode of Why We Nurse. If this story opened your eyes to new possibilities in nursing, share it with a colleague or a student. Follow at Why We Nurse on Instagram for updates and behind the scenes content. Got a story to share or want to be a guest? Email me at whywenursepodcast@gmail.com. Until next time, stay strong, stay compassionate, and remember why you nurse.